Did you know there are deadly diseases that can creep up on you without showing any warning signs? These silent killers often strike without symptoms, leaving people unaware until it's too late. From hepatitis C to certain cancers, these conditions can go unnoticed for years, causing life-threatening damage behind the scenes. In this video, we're uncovering 10 killer diseases that can develop silently and explaining why early detection is crucial. Stick around to learn how to protect yourself and your loved ones from these hidden health threats. Let's dive in. 1. Hepatitis C. Hepatitis C is a viral infection that causes liver inflammation. It often remains undetected for years, as early symptoms are rare or nonspecific, such as fatigue or mild abdominal discomfort. If untreated, it can lead to chronic liver disease, cirrhosis, or liver cancer. Advanced liver damage may only become apparent in its terminal stages. Prevention and detection. Regular screening, especially for those with risk factors like intravenous drug use or unprotected sex, is critical to identify and treat the infection before irreversible damage occurs. Antiviral treatments to clear the infection. 2. Type 2 diabetes. Type 2 diabetes can develop gradually, with mild or no symptoms in its early stages. High blood sugar levels over time damage blood vessels, nerves, and organs, even before symptoms like excessive thirst or frequent urination appear. Complications include cardiovascular disease, kidney failure, blindness, and non-healing wounds that may require amputation. Prevention and detection. Regular blood sugar testing, especially for high-risk groups. Also, awareness of risk factors like obesity, sedentary lifestyle, and family history are key to preventing undiagnosed diabetes from progressing to severe complications. 3. Hypertension, high blood pressure. Hypertension is often called the silent killer because it rarely shows symptoms, even as it silently causes damage to the body. High blood pressure puts extra strain on arteries in the heart, increasing the risk of heart attack, stroke, and heart failure. Prolonged hypertension can also lead to kidney damage and aneurysms. The lack of symptoms means many individuals are unaware of their condition until a catastrophic event occurs. Prevention and detection. Regular blood pressure checks. Lifestyle changes, including a balanced diet, reduced salt intake, and regular exercise. 4. Osteoporosis. Osteoporosis, characterized by weakened bones, develops silently over years, as it rarely presents symptoms until a fracture occurs. Bones lose density and strength, increasing the risk of breaks from minor injuries. Hip, spine, and wrist fractures are most common, and complications from these injuries can be life-threatening, particularly in older adults. Hip fractures, especially in older adults, are associated with significant mortality due to complications like infections or blood clots during recovery. Prevention and detection. Bone density tests can identify osteoporosis early, allowing interventions such as dietary changes, exercise, and medication to slow its progression. Calcium and vitamin D intake, along with weight-bearing exercises. 5. Glaucoma. Glaucoma is a leading cause of irreversible blindness worldwide. It occurs when increased pressure in the eye damages the optic nerve. Most types of glaucoma progress without noticeable symptoms, such as pain or vision changes, until significant damage has occurred. By the time peripheral vision loss is detected, it is often too late to restore sight. While not directly fatal, glaucoma leads to blindness if untreated, severely impacting quality of life and increasing the risk of accidents and injuries. Prevention and detection. Regular eye exams are essential for early detection, especially for individuals over 40 or with a family history of glaucoma and treatment, which can include eye drops, laser therapy, or surgery to reduce eye pressure. 6. Atherosclerosis. Atherosclerosis is the buildup of plaque, fat, cholesterol, and other substances in the arteries, which reduces blood flow. This condition develops slowly and silently over decades and rarely causes symptoms until a critical blockage occurs. Atherosclerosis underpins many cardiovascular diseases, including heart attacks, strokes, and peripheral artery disease. By the time symptoms like chest pain or leg cramps appear, the disease is often advanced. Prevention and detection. Early detection requires regular cholesterol and blood pressure checks. Lifestyle modifications and managing risk factors like smoking, high blood pressure, and obesity can prevent or slow its progression. 7. Chronic kidney disease (CKD). Chronic kidney disease progresses silently, with symptoms like fatigue, swelling, or changes in urination appearing only in advanced stages. The kidneys play a crucial role in filtering waste from the blood and maintaining electrolyte balance. CKD can lead to kidney failure, requiring dialysis or transplantation. Common causes include diabetes, hypertension, and autoimmune diseases. Prevention and detection. Early diagnosis through routine blood and urine tests allows for interventions such as dietary adjustments and medication to slow disease progression and controlling underlying conditions like diabetes and hypertension. 8. Certain types of cancer, e.g., pancreatic, lung, and ovarian cancer. Several types of cancer can grow undetected due to their lack of early symptoms. Pancreatic cancer. Symptoms like abdominal pain, jaundice, and weight loss often appear only in advanced stages, making it one of the deadliest cancers. Lung cancer. Early lung cancer may cause no symptoms or only a persistent cough, which is often overlooked. Ovarian cancer. Symptoms such as bloating, pelvic pain, and changes in bowel habits may be vague or attributed to other conditions. Prevention and detection. Regular screening for high-risk individuals and awareness of family history are crucial for early detection of these cancers. 9. HIV/AIDS. Human immunodeficiency virus, HIV. The virus that causes AIDS often remains asymptomatic for years. During this period, the virus damages the immune system, leaving the body vulnerable to opportunistic infections and cancers. Early symptoms like mild flu-like illness can go unnoticed. Without treatment, HIV progresses to AIDS, characterized by severe immune suppression. Prevention and detection. Regular testing, especially for individuals with risk factors like unprotected sex or intravenous drug use, allows for early initiation of antiretroviral therapy, which can control the virus and prevent progression to AIDS. 10. Sleep apnea. Sleep apnea is a condition where breathing repeatedly stops and starts during sleep, often without the individual being aware. Obstructive sleep apnea is the most common form, caused by throat muscles relaxing and blocking the airway. Symptoms like loud snoring and daytime fatigue may go unnoticed or attributed to other causes. Untreated sleep apnea increases the risk of high blood pressure, heart disease, stroke, and even sudden death. Prevention and detection. Sleep studies and interventions like continuous positive airway pressure, CPAP. Therapy can manage the condition and reduce risks. Conclusion. These silent diseases pose a significant public health challenge because they often progress undiagnosed until they cause severe complications or death. Regular health checkups, screenings, and being attentive to risk factors and family history can save lives. By taking proactive steps, individuals can manage these conditions effectively, reducing their impact on quality of life and longevity.